on Teams, but I will move this over to the recording file so you guys will get it. I'm not sure why it's stalling, but hopefully that stops. So you guys do have the ICD-10. Some of you have started early. Some of you were already in the course. You can utilize this video. This is your introduction video. This is for the new students who are coming in September 3rd. Some of you have come in before that. That's fine. In this chat, this is just letting you know what is in your ICD-10 course. Some of you have not done ICD-10 before. Some of you may not even know what it looks like. Your ICD-10 manual is what you will need for this section. I have one down here just to kind of show you. And for some of the teaching purposes, you can use the 22. That's fine. You can use the 22. This one is old, it's a hot mess. But you can use this one. When you take your test, I want to make sure that you get the new one. Okay, so some of the guidelines may have changed, but I know that this book is expensive. I would prefer you guys to try and get the new book. If you can get the 2024, that book is coming out in October. If you've gone for the 2023, that's fine. When you guys start your course, just, you know, as a beginning, just to kind of get you used to what ICD-10 is and some of the coding, yes, you can go ahead and use the 22, 23. When you get ready to take your exam, I want you to have a new book. Okay, so in this course, we pretty much go over what is ICD-10? Where did it come from? How do we utilize it? We go over the numeric portion, we go over alpha, we go over tabulars, we go over index. This section will show you how to navigate through ICD-10. You guys have these slides already. Some of you do. And I've transferred a lot of the data in PDF format. I love the PDF format because you can open it whenever you want to. You guys can also look at this on Teams if you want to. When I send you an invite for the Teams, it may ask you to, I guess, make an Outlook email. You can just make one just for this, that's fine. But you need to have the Gmail for me to send you the docs through the Google Drive. To get into the Teams class, which is now converted to Teams because everybody seems to be okay with the Teams. I use the Teams at work and, you know, we're fine at the hospital, you know, with this, everybody uses it. And I think that is okay for you guys to use too. So I have one specifically for Sapphire position coding. I want you guys to go ahead and utilize it. I can't answer that right now. So let's just get started. And I'm going to go through some slides. I know the previous introduction slides, there are probably like 100 or more, but this one is kind of slow because I'm going to go through this just briefly, just to kind of give you an idea of what the ICD-10 is. You do have ICD-10 exercises. Remember, that step-by-step book also, that book is incoherent with your ICD-10 and also your CPT. Some of you who are only in the course for just the billing, you still need to have the ICD-10 because you need to be aware of this when you're in the doctor's office, even if you're not going to be a coder. But the coders, this is for you. You have to get this inside out. You will get ICD-10 tests, tasks, competencies, the same as the other courses. So let's just kind of go through this. And remember, your ICD-10 is the same way. Coincide that with your step-by-step book. The step-by-step book is your learning material. That's how you're going to learn to code. Look in your file. I put the list of books there. The step-by-step book is there. Okay, try to get the new one. Go to elsafel.com. Sometimes I see that book on Amazon, so try Amazon. But, you know, those of you who are just starting, continue on your medical terminology. I've already given you the book for that. You can also do all of the tasks and you can submit them all to me at one time. I'm okay with that. Some of you are working, you don't have time to submit the tasks. That's okay. The purpose of me giving you the medical terminology is so that you will have time to get your books. Okay, you will have time to get your books. If you're finished with medical terminology, you can do medical billing. That's enough time for you to get your books. So again, don't rush, take your time. So right now I'm going to share my screen just so we can start going over the slides. And it's pretty much, you guys have the same type of information. I like to make sure that it's on slides and you can kind of go back at it. And you guys remember, email me, ask me whatever you need in case you need assistance. Lisa.lambert@sapphirecoding.com. Okay, I have a Gmail too, it's Sapphire llbc@gmail. So I'm going to go ahead and let's see if we can share the screen here so you guys can see what I'm talking about. And this is pretty much slides just letting you know what your course is about. Like I said in the beginning, some of you have not seen ICD-10, at all, or some of you may not know, what it's about. So that's what this is. And if we can get this slide open, it will be fine. Let me see if I can get the right slide so you guys can see, what I'm talking about. Let me know if you guys cannot see this. Some of you who are not in the classroom, that's fine. But those of you, let me know if you can see this. And don't forget, you guys can text me. I'll see it, and whatever, I'll get right back to you if you're not able to get to this. But if those of you who are archiving this, make sure you get at me. Okay, so welcome to ICD-10. And again, this is your introductory session to the ICD-10. Okay, some of you go back with me to ICD-9. When we went through that transition, it was such a flip-flop off and on, but I know some of you are ICD-9 savvy. So you guys will know, the transition from those two series. Some of you who don't know, we're used to code by ICD-9. The ICD-10 is much, much better. And I know a lot of people resigned, a lot of people quit. A lot of people moved on to different things when we were transitioning to ICD-10. I mean, it was like people get in the computer and like, oh no, I'm not doing that. No, and it was so many people retiring from coding. It was crazy. But when you go into the new ICD-10, oh, okay, it's not new anymore. I think 2015, 16, we transferred over. It's a lot easier than ICD-9. And I'm gonna tell you why, because it is more explanatory. It's more definition. It explains more about the disease. You can find your codes better. Okay, so here we go. Let's do the introduction. Understand the concepts of ICD-10. That's what we're going to do. Have knowledge of ICD-10. Okay, the guidelines. The guidelines are so important. You guys, I want you to read the guidelines 100 times. I'm exaggerating, but as many times as you can. And you get ready to take your test. You have to find stuff in that ICD-10, in those guidelines. The beginning of those guidelines, I'm gonna try not to keep grabbing this book, but I just want to show you in the beginning of the guidelines. Those of you who might have your book already, in the beginning of this book, this is your guidelines. I want you to read, highlight, read. You see this? You know I get carried away with the tabs, but I got to find what I need to find. Okay, so you guys know when you take your test, it's not going to be it's hard. I'm telling you, I'm not sugarcoating it at all. You're going to stay focused. When you go out there and you're working in the coding world, it's not hard. We have so many tools that you're going to use. And most of them, the providers put their codes in anyway. Yes, you have to check the codes. But the hardest thing that you'll ever do in the coding is taking your CPC. Okay, taking your CPC, being a master at what you do. Okay, so how do we perform ICD-10 CM coding? How do we look for the primary diagnosis? Know what symbols that you're coding for, know what they mean, understand those numeric numbers. How many numbers do we need? How many digits do we need? What is the seventh digit? What do we use for orthopedic? What's first initial inpatient, second? There's so many subsequent. Okay, so those type of things, that's what we're going to learn. I know it sounds a lot, but I'm going to make sure that you guys know what you need to know. I'll put you in the right place where you need to be. Okay, students need to know how to code diseases. That's what it's about. That book is about diseases. What's wrong with the patient? Find the disease of what's wrong with the patient. The patient has asthma. Find the asthma. Anybody can tell me how we find asthma. Go to the index, find asthma, go to the tabulars, check the code, make sure it is right. Okay? And we're going to go through that. Your index to diseases is in the front, your tabular list is in the back. You can tab that as much as you want and highlight things in there too. We're going to go over that. When you read your PDF files, you see a lot of stuff that I put in there for you to go over. Make sure you read those files. Okay, students will have a precise understanding of how to navigate through the ICD-10 CM book. Okay, so you guys are going to look at that book so much. You're going to say, Ms. Lambert, oh, Lord, I can't, not today. I used to do the same thing. I'm telling you, I used to be just tired of this stupid book, and I would throw it across the room, but you're not going to do that. Okay, I want you to read the book, highlight what you need. That's why I don't want you to overwhelm. I don't want you to overstudy. Don't overstudy. 2 hours, that's enough. You know, even if whatever subject you're doing, CPT, ICD-10, and whatever introduction level, your 2 courses in these 2 sections, these sectors are getting you to know what ICD-10 is, what CPT is, and you're going to be coding the ICD-10 and and CPT. You see how I just put a little bit of information in here about ICD-10 and when we moved over from ICD-9. Welcome. In this section, you will have an overall view of what ICD-10 CM is all about. If you are new to coding, this is your first stop. This is your first stop. It is not mandatory, although it will be best for you to review this section prior to procedural coding. Procedural coding is a CPT. Okay, you can't do one without the other. If you're doing the CPT and coding, you need to find out what the disease is. When you have a note from a provider, whether he's doing a surgery or not, in the note, you see at the top the disease as far as what he did. Then you're going to see the procedure as far as what he did in the procedure. At the top, let me phrase that. You're going to see what the patient has, what the patient's sickness is. Why are they doing the surgery? That's what the diagnosis is. We're doing the surgery because the patient has this. We're doing the surgery because the patient has kidney failure or whatever. Okay, so just take heed to that, and you'll be just fine. They have many versions of ICD-10. I want you guys to use the AAPC version. Go on their website or get it from Amazon. Okay, I remember I told somebody, I don't know if it was the other day, and I used a different version when I first took mine, and you know, I don't know, I was all over the place. So I want you guys to get the AAP version because they're the ones who made the test that you are going to take. Okay, ICD-10 CM is published in 2 sections. Review this portion. This is the alphabetic index and the tabular list. Okay, that's what we were talking about a few minutes ago. Okay, this section here is how you're going to learn how to code. There are 2 parts, okay? And listen, those CPC guidelines that I just put in there, make sure you read them. Make sure you read them and highlight them. That's a portion of your course. I'll just do that in there to make sure you guys don't forget. Okay, these are diagnostic terms, organized in alphabetic order. And when you open your book, some of you might have your book already. When you open your book, you're going to see that anyway. Your tabular list, diagnosis code organized in numerical order. Okay, what if you have it on your test? Highlight that. It's in numerical order. Highlight that. Okay. Your ICD-10 codes establish the medical necessity for the service. Medicare says, well, why are you doing the service? What's wrong with the patient? Patient has nephrology. The patient has a broken leg. I'm mending his leg. I'm putting screws in it. I'm putting it back together. Okay. So we need to know the reason for the surgery or the service. You know, that's just like if a patient comes in on a medicine visit. Why is the patient here? The patient is getting gastric bypass. What's the reason for the visit? The patient is overweight and having issues. Okay. The patient is borderline of diabetes. So, you know, they need to know why. That's why they give those referrals and authorizations, because they want to get paid, right? So, you know, that's why you guys are very important. It's not just about, you you guys are doing working in billing. It's about, helping the providers and helping the facility. We all know, AI is coming. I throw that out there to everybody because I went to so many places just to see what's going on. And I keep seeing these little computers, they're taking the registration. And I'm going, well, so this is what's getting ready to happen, huh? Okay. You know, I mean, I went in doctor's offices and I see patients just standing there, pip, 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 arm checked in already. And I think I posted something on Instagram with one of those machines. I'm like, okay, well, you guys can't replace coders and you can't replace the billers. Okay, now some of you registration clerks and you guys are working the front, I don't know. And, you know, I don't know if AI is going to hit credentialing or anything like that, but we want to make sure that we're ready for AI or COVID or whatever's next. Okay. Uh, you know, we still have, you know, that third party, you know, we still have, you know, those affiliates that was check these claims before they go through. Okay. I'm not going to tell you what that is because that's in one of your courses. I want you guys to learn that. They check those claims before they go to the third party insurance company. What do we call them? Y'all on mute, so you can't talk anyway. Just tell me, just type it in. Yeah. But listen, you just told me that. I want you to make sure when you get that on your test, I'm telling you, I don't know if I seen it or not, or I did or not. I'm gonna give it away because I got to give it away just in case you get in. Clearinghouse. Look, when you see that, if they sometimes the AAPC will slip you up, or how you spell clearinghouse. Don't go clearing space house space gone. Put it together. Okay, so I'm getting that one away in case you get that on your chest. Okay, so wait, let me get that. I got a lot of stuff to tell you that might be on your test. You never know. I'm telling you, that's the purpose of this class. And no, I don't want you to go to billing school and pay $13,000 for something that is your heck. I can teach you, teach yourself. Okay, don't do that. Don't do that. I don't want none of my students having any issues with that. I'm not, you know, when I taught at the school, you know, to college, yeah, you know, I still feel bad that they had to pay $16,000 for, you know, of course, but I'm glad that they all, most of them, you know, have jobs in medical bill. Okay, so diagnosis: a patient comes in with a bad cough and congestion. Okay, work with me because if I find errors in this, I'm fixing them on the way. The provider performs a chest X-ray. On the claim form, the coder assigns the diagnosis. If the coder is a charge entry coder. Now, I told y'all they asking for certification for that now. Y'all want to get up in that, get in there now. Some hospitals are not asking, but they are requiring you to get it in 90 days. If she drops that diagnosis in there, it's what the provider has put. The coder is going to check that. The coder is going to check that. Wherever you live, Texas, Dallas, Philadelphia, New York, Boston, Massachusetts, she's going to get that. You're all going to work for the same EHI system. She's going to go in and get that. Everybody have different queues. Okay, everybody have different queues. Charge entry clerk, she has access to everybody's queue. Okay, so when they say a coder assigns a diagnosis, I'm giving you both of those scenarios because 9 times out of 10, the doctors already put the codes in. If you're a scratch code or a subscription, you're going to do it from scratch. Okay, and that's fine. Just, you know, just take heed to what I'm telling you. A diagnosis code for the documented cough and congestion. We support the service. Find the code for the cough and congestion because this was the reason for the visit. Okay, the medical necessity for the X-ray is needed. Why did they do the medical necessity? That's what they need it for. Okay, if there's no definitive diagnosis, code the signs and the symptoms. Okay, you see what I have here? I have the cough. Well, I don't know why I put that there. I want you to find it, but I probably put it there as an example. Okay, so you guys go and find those codes and you let me know the extent of those codes. Okay. Medical necessity, we just talked about that. Establishing medical necessity is the first step. And third party, this means the carrier who will be paying the physician is the first party. The patient is second, and the insurance carrier is third. Okay, they're the third party reimbursement because they're the ones who's making a payment. Okay, the patient is normally they make the patient. We're billing the patient if they don't pay. That's for the billers. Okay. The physician is doing the service for no fee in the beginning. He has to get reimbursement. Right. So that's pretty much what they mean in reimbursement. I mean, technically, everybody's doing services and they're not getting paid right up front. Okay, when they have insurance, we do the service, and then we are billing the service for the procedure. But we have authorization for the service. Okay, that's the purpose of the girls in the front. They get those referrals. The billers in the referring department, they get that. Okay, and you guys can go over this. I'm gonna move this out the way because it looks like it's cutting off your. I don't know how far that can go over, but I need you guys to see this slide. I don't know, wasn't that big before? Example, I think I got this from AAPC. You see me with AAPC or something at AAPC. I always kind of put whatever I get from them. So knowledge of the emergent nature or severity of the patient's complaint or condition. Assuring that the patient does have an emergency. This is the chief complaint. What is it? Or that the patient is really in an emergency. Who can tell me why do we go to the emergency room? What is the emergency room for? So what if there's a question on the test that says, okay, so why do people go to the emergency room? If you're sick? No, and no, you need to go to urgent care. People generally supposed to go to the emergency room when there's a life or death situation. It's a total emergency type of situation. They don't know what's going on. You know what I'm saying? Somebody gets hit by a car and the ambulance is bringing them in. We don't know what's wrong with this patient. Might have life or death. And this is because they haven't analyzed the patient yet. Okay, they'll find out. But remember those two differences, okay? All signs, symptoms, complaints, or background facts describing the reason for care, such as required follow-up care. These facts must be, you hear me say facts, right? You have a fact. If it ain't no facts, then it didn't happen, okay? If it's not documented, it didn't happen. Good. These facts must be substantiated by the patient's medical record, which must be available to the payer at request. So yeah, United Healthcare might say, listen, let me see the medical records. We had a case not too long ago where, I mean, was it a neurosurgeon? It was a neurosurgeon. He was doing all these neurosurgeries and all this stuff. Oh yeah, the patient need to have that. Yes, yep, yeah. We did about 255 in 2021. Okay, so here comes Medicare. Let me see everything that you have that's telling us that we should have paid you for these visits. Did you do this? Did you do the sleep study? Did you do this? Did you check that? Did you send the patient for that? Kind of like bariatric surgery. If they don't do all that follow-up, Medicare is either asking for their money back or they're going to recoup that money back from that provider. So what do we call that? What do we call that? When the insurance company is, they digging, they want their money back. It's justification. It's justification for the surgery. It's justification. But what else is it? Like, what are they doing to the provider? They're investigating. They want to know, XYZ. And I've been to a place before, people just quit when things like that go down. The provider's being investigated. They want to see, is he doing this stuff, how he's supposed to? Is he getting everything that he needs? Why is he doing this? So just, do your due diligence and make sure that the provider has everything that he needs. In some cases, you need the provider to be presented before the board. Because once they start doing their investigations and we start pulling up stuff, we start pulling records and sending in stuff, everybody got to be on the same page. Okay, no, I'm not going to tell you what it is because it's on your test. And if I do, then I'm giving away something else. It's a specific name for it, but I'm not going to tell you what it is. You should have gotten that from everything that I just told you. What? Okay. What is it? Okay. You're right. Okay. So let's move on. Make a note of it. Make a note of it. Okay, ICD-10 PCS, quick overview for your hospital coding. There's hospital code in ICD-10 PCS. You will not learn ICD-10 PCS in this course, but it will be in a book that is ICD-10. You can learn this if you choose to. This is hospital coding. We do the physician side of the coding. I have a girlfriend down in North Carolina. She does a HEMA. She does the hospital coding. ICD-10 PCS includes procedure codes and is typically used by facilities for inpatient services. Hospitals use ICD-10 PCS in the inpatient hospital facilities for tracking purposes only and do not submit claims using ICD-10 PCS. Okay, so there will be stuff in there that you do submit with ICD-10 PCS that they are accepting now. So just be precarious of that when you choose which fields you're going to go into. You can do ICD-10 PCS with a HEMA. They will go through that step by step. There's a small section of it in your step-by-step book, and we can go over that. You could go over that in your book. Remember what I said. I want you guys to make sure you are savvy with what you're doing. You see something in there that's not in your PDF that I sent you, make sure you go over it. If you want to go over it with me, call me and let me know, and we can go over it. Don't forget, I can set one-on-one Zooms for you guys, and we'll get through it. Okay, ICD-10-CM, let's discuss the tabular list. When you are searching for a diagnosis code, be accurate when making your choice. This information will guide you on how to look for confirmation of the code you have chosen. You will have, you also have a broad range of codes for you to find, or if you want to find a better one. So yeah, sometimes you find a code and you have a question about it and you're like, I don't know if I really want to use this or not. You could always backtrack and double check. Look at those notes again. Look at those notes again and see if the code that you have chosen fits the notes that you've done. Now, this is for testing purposes. 9 times out of 10, if you're working in a hospital or even a facility or whatever, they have an Optum 360 or a ContextNet coding system where you're just going to put in what you need and you get the code back. You still can read the description down there to make sure you got the right code. Okay, so if you need to find a better one, find a better one. If you think that code is not good, it's not good. Now, the problem with this is when you go on your test, you don't have time to be second guessing yourself as to what code is what. Try to be precise the first time so you can move on. Okay. Tabular list. The tabular list is where you're going to recheck your codes you have chosen. Locate this by using the characters you found in the index of diseases and injuries. So you remember what I said, you find your codes in the index. Find what you're looking for. That thing is in alphabetical order. Put those numbers in the back and see if they are compatible to what you are looking for. Okay. The ICD-10 book, I think I gave you guys some pages to do, and you guys are going to do also some cases. When we get up to the coding portion, I'll be able to show you guys some of what I'm talking about. I'll have to figure out how I can highlight this book and show you some things without taking the book and putting it up here, like that, because you guys are not physically in the classroom. I mean, I've seen some of my girls, well, teachers that I know that teach online. The book thing and the putting it up here, I can't. We can't do that. But I'll figure out a way. I might just snapshot and then maybe I can put up there to show you a couple of things in it. But I will do it so I can definitely show you how to highlight your book. So just follow it. You can stop this video and then you can keep going and stop it. Make sure that you highlight differences in the codes. Their codes in the tabular list, they look the same. They sound the same. Highlight those differences, especially in I can even say obstetrician, the baby portion. Some of that stuff sounds the same. Make sure you highlight those differences so that you know when you get ready to go in there and code. You'll be looking at that book enough to know. Okay. Again, this is us talking about the tabular list. The tabular list lists a numerical portion of diseases and injury. Take notes and retain this information. The exam may ask you, what does the tabular list contain? That's why I need you to look at the tabular list. Don't get the tabular list mixed up with the index. When you open your book, if you have your book, open it. You see numbers, tabular list, index list, has alphabets. Okay, those are words and characteristics. There are 21 chapters for the classification of diseases and injury, grouped by etiology, cause, or anatomical site, as in the body. The etiological, I can even say etiology cause is what? Cause is the disease, right? Okay, good. On page 1, you'll find the answer to how many chapters are there in ICD-10-CM. Tab this page in case you forget the number of chapters in ICD-10. Yes, and this is a part of you guys marking your ICD-10 book, because in the test, they're going to ask you so many things about the book. I'm telling you, the gist of it is to get to know your book. They want to know, can you find this? They want to know, do you know where this is? Do you understand this? What's in the guidelines? What's in the beginning part of the ICD-10 book? Has she really looked at her book? That's what they want to know. Okay? The 21 chapters are in there. Your course has 21 chapters. The 21 chapters is based on you going through every single chapter of the book. Category codes. The tabular list is organized in 3 character codes and their titles. These are called category codes. Okay? Category codes. You see them 1, 2, 3, category, subcategory. And and you know what that is? That's one, you find the cause, you find the disease, and then they start going into more depth. What kind of disease is it? Where was the disease that they did? But they do it by numbers. They do it by numbers. Okay, so some 3 character codes are very specific and are not subdivided. 3 character codes are some specific. Here, I thought I had an example there. R52, painful. It doesn't specify anything. If you had it on the test, it would be unspecified. It's unspecified, but it's painful. You start specifying it, then your digits get longer. Your numbers get longer, your letters get longer. Okay, so that's what they mean by 3 character codes can stand alone to describe the condition being coded. What's the condition in this one right here? Painful. Why is the patient here? What is the medical necessity of me? Why should I pay this claim? Because the patient is painful. That's why the patient is here. Let's find out why. Then you start going into more digits, 4th digit, 5th digit. Most 3 character codes, rubrics, have been subdivided with the addition of a decimal point followed by up to 4 additional characters. Okay, and this is what I was telling you about as far as expanding the code, telling you what's wrong with the code. R10.83. You guys go ahead and look up that code, those of you who have your book. You can put it in the search engine. That's all right. Some of you guys already have a Optum 360. That I use the Optum 360 for the coding. So some of you who have it already, you can go ahead and use it. It's okay. Okay, so characters. When I'm talking about characters, these are the letters or numbers that are inside the code. Each character for all categories, subcategories, and codes may be either a letter or a number. Codes can be 3, 4, 5, 6, or 7 characters. A character can either be a number or a letter. The first character of the category is a letter. Let's talk about the category. So when you get ready to start coding, right, you find your code that you're looking, and then you're looking up the code. The first 3 characters is the category. That's the category. That's the category that you're in. The subcategories, which you guys can probably get this. If you got a category, then it's a subcategory. It's more. It's more. It's telling me more. It's telling me more. Are either 4 or 5th digit character. The final character can be one of several letters. The 6th character. Okay. If you're in orthopedics and they want to know the initial character, whether it's your first visit or second visit, you have a 7th character. Okay. It's not a number 6 because that even sounds confusing to me. It's not number 6. It'll be a number. It'll be a 6 number, but it will be a number. Did you guys get it? Okay. Just call me. So number characters. Some codes have 7 characters or called extensions. Okay, we just kind of talked about that. When you go through your book, you'll see that. Those of you who do have your book, go ahead and go through the tabular list. And it's kind of hard to follow along, but go through your tabular list just so you can see some of these things. The 4th character defines the site, etiology, and manifestation of the disease or condition. Etiology is the disease. This is what's wrong with the patient. Manifestation is that the disease is manifesting throughout the patient's body. It's kind of like a metastasize. Institute is this is a disease. The disease is here. It is in situ of this area. It's staying in this area. It's not traveling through the patient's body from his hip to his leg. It is in situ right here. Metastasized manifestation is it's growing to other bodies. She had, I hate to use this as an example. We have so many people who have passed with this. She has cancer. I'm just going to say cancer on the right and it metastasized to the left. That's all I'm going to say. Okay. Code to the highest level of specificity. You know I can't stand that word, but get it down. That's something that will be on your test. You know what AAPC will do? Well, how do you spell specificity? I can't say it. You probably say it better than I do. They're going to ask you how to spell that. When I say specificity, I'm talking about the highest level of care, the highest level of the disease, the highest level of how the doctor is specifying it, the highest you can go. Okay, now you can't overcode it because it's a disease. It's not like procedure coding where you code 10 codes and you only need one. You see what I'm saying? So people do that. So you have to watch that. So yeah, that's in your CPT. We haven't done CPT intro yet, but we'll do that. Okay, so subclassification, 5th or 6th characters. This represents the most accurate level of specificity. You see how it's saying specificity, most accurate level of the disease description. I'm saying that because to look at specificity, you know what it looks like, but you guys look it up so you can get that proper definition. It means to the highest level of the disease. Subclassification, you see subclassification is the 5th or 6th. Subcategory was after 3, 4, right? Okay, good. You see, it's just going further and further. They're just further specifying the disease and or diagnosis. 7th character. The 7th character is used in some instances. Follow the tabular list instructions. If a 4th or 5th character code requires a 7th character, use the X placeholder to put in the place of the 6th. This is a good one. Then put the 7th character in. This is what I mean by that. If there is no need for a 6th character or a 5th character, and they are requiring a 7th character, use X in those places. Bing, now put that 7th character in. Because on the claim form, you have to have that whole thing filled. So you have to have placeholders for that. And that's what they call that. Okay, stop this video, read that again if you guys didn't get that. You have to have the placeholders. This is the same information that I'm giving you is in your ICD-10 book. So you will get the same thing in your ICD-10 book. You'll have to find it as reading, but it's the same thing that we're going over. Okay. Okay, this is what we're talking about. We're talking about the guidelines, and this is where this is coming from. This is all from the beginning of your book. You have to read the ICD-10 from the beginning so that you can understand the concepts of ICD-10 coding. Okay, if a 7th character is needed, you will see a symbol in the red that indicates you must add 7th character. In your ICD-10 book, you will see that. If I pick this book up now and show you, you're not going to be able to see that. But I found a way, I think, to show you guys. But you guys can see that from there without me dropping that book up to the screen. So this you will see in musculoskeletal category. Look through your. You see in other categories, but I'm using that one because you're going to see a lot in the musculoskeletal category that is requiring the 7-digit. Okay, so just look through it page by page. And some of you have different books, which is fine, but just look through it page by page, or you can get used to looking in that tabular list. Okay, so index to diseases and injury section. So main term in the index to diseases and injuries, reference diseases, condition or symptom. Subterms modify the main term to describe differences in the site of the etiology or clinical type. Subterm and further modification to the main term. That's pretty much almost the same thing. The main term is the what? What's wrong with the patient? Why did the patient come in? Absolutely. And this is just further classifying it. Clinical type is as in the same as etiology. Okay, what type of visit is the patient here for? What kind of surgery is the patient getting? Okay, some of you who go into a medicine or doctor office, you won't see surgical stuff, but they do have ambulatory stuff that you still need to code. This looks funny. So in this section, we just code search. Okay, look in the index to diseases and find your category. Okay, so let's say you're looking for pain in the index to diseases. Go to P. Go to P. Okay. Look for the word pain. Look for the word pain. When you find the word pain, look for R52. Okay. That's your category. So the category that you are looking in is pain. Now, where is the pain? You need a fourth digit to specify where this pain is, because we know the category, we know the main term is pain. We know that it's R52. Where is the pain now? You need a fourth character. You got it? The pain is in the abdomen. So what are you going to do now? Yeah, look for abdomen. You know. Good. You see, it just changes to give you more. If the doctor had just said pain RF52, pain unspecified, it would have been pain unspecified. But we're looking for pain in the abdomen. What type of pain is it? It's acute abdomen pain. See extra stuff in it. No, find that one too. Find that one too. Find that one too. You got it? Okay. Where in the lower abdomen? R1030. And you see how I kind of specified that? You have pain in the abdomen. Where? But you see how the specification just goes and keep going. I'm gonna say the rest. Specify. I can't even say it, but you guys know what I'm getting at when I say specify. Specificity. Why they use that word, I don't know, but they do. You guys better make sure you get it. Okay, and put it on the index card. You know how I am about index cards. I don't care if you got 1,000 index cards. I'm not going to tell you a story about my friend with 1,000 index cards, but put them on index cards. Okay. Okay, so let's move on because this one is a little lengthy. APC testing technique 10. Highlight conditions following excludes 1 and excludes 2 notes. This will help you draw your eyes to the excluded condition while you are taking your exam. This is really throughout the book. Highlight excludes 1 and excludes 2. It's going to look confusing, but I want you guys to make sure that you read excludes 2 and excludes 1. It's in your course. It's in your file. It's in your file. I've already put it in there. But I need you to make sure that you read it with clarity. If it's not clarity to you, then get back to me. Then we got to figure out a way to get you to decipher from the 1 excludes to the 2 excludes. Okay, when they say excludes, they are excluding out other diseases because there are some diseases that are adjunct to another. When I say adjunct to another, I mean they are related. They're related. They're related. She has bad lungs. She's coughing like crazy. They're related. That's adjunct. She's coughing because she has bad lungs. She's coughing because she's smoking sensation. You see? So if you say excludes 1, excludes 2, that's different. If your leg is hurting and your chest is hurting, that have nothing to do with one thing or the other thing. You're excluding one thing. You're excluding the fact that her heart has nothing to do with a feet or a leg. Okay. So as you read on, and I know that sounds, it's a little fast, but as you read on and you get to know ICD-10, these are the things that you will know. And just make sure you guys get in on the ICD-10 because I know class doesn't start for you guys until September 3rd. Some of you who are already in a class, you're on this video, that's fine, but you've got the same video when you started. We talked about the same things, but those of you who are brand new, just, just read your materials, read your material and get in on the live chats. Remember the coding is Saturdays. The coding is on Saturdays and the billing is I think Wednesdays. Those live chats for you guys, those of you who are new, will begin on the 3rd. But you guys can always get the archive chats from Teams for those sessions. But I want you guys to get on the new ones because the live sessions will give you a chance to get in and you can talk to me on the live sessions. If you can't, that's fine. Just archive and send me a text or email. I always try to get back to you. Okay. So here I did put, an example of those excludes notes. Okay. So excludes notes. And that's how it says in your ICD-10, excludes. Okay. The excludes note appears immediately after a 3-digit character. I'm saying digit, but it's 3-character code title to further define or clarify the category. Example, code N40. You look up that code. I think it's a kidney, something to do with the kidney for that one. Code N40, you will see it includes underneath this code with words or terms that can be identified within the code. Read your guidelines in this section. It will clarify your findings. Now, I'm telling you, I'm directing you to the guidelines because if you don't get the differences between excludes 1 and excludes 2, it's going to jack you up. Okay, I need you to make sure you know the differences between that. When you guys get in on your live class, those new students, make sure you ask a lot of questions. Okay, N40 includes appears immediately after a 3-digit character code title. It's includes adenofibromatosis. That's not an error. That's the way you spell that. So I'm not going to fix that. Hypertrophy of prostate, benign hypertrophy of the prostate, benign prostate, hyperplasia, benign prostate, hypertrophy, BPH. You look up all that hyperplasia, hypertrophy. Make sure you guys know what that is. Okay. Nodular, you guys know what I'm talking about by, you know what BPH is, right? Look, I'm talking about the prostate. I'll just tell you what it is. Look at it. It's right in there. How many of you guys seen your husband's thing where they have the BPH on it? I'm a male too. You guys know what it is. Okay, nodular prostate, polyp of prostate. When you see this term indicated are included with the code, they are included with the code. You do not need 2 separate codes if the disease is listed. You see, and that has to do with a lot of the upcoding too. That's why I want you to make sure you understand the excludes 1 and the excludes 2. Okay, let me just read this again and make sure it makes sense. It sounded a little funky to me. No, it's okay. Okay, review excludes 1 and excludes 2 in your guidelines. I can't express this enough because there's going to be an answer, a question on your exam, and it might be what is excludes 1 and excludes 2. Note, etiology is a disease. Okay, it's a disease. Hold first the principal diagnosis, what the patient came in for. This would be in the patient's own words. Okay, that's what being patient's own words until the physician has formally diagnosed the patient. Do not do any type of coding until the patient has said what's wrong with the patient and the provider has given a final diagnosis as to what's wrong with the patient. Okay, if we can't find a final diagnosis as to what's wrong with the patient from the provider, you put in there what the patient came in for. Okay, the notes can be fixed later on. For them to move on, they've got to put at least what the patient came in for. Okay, additional codes. Using additional codes, there are cases where additional code must be used. The code or a diagnosis involved over overdose of drugs. Look how I spell this. I think Dimitri's purposely doing this. Overdose of drugs. You must code the drug as a second code. And that's gonna be fun when you get to the overdose of drug. Because some of you might work in a facility where they're doing that type of coding. And in the emergency room, they do that type of coding. Some of you who may be doing emergency room coding, you're going to see a lot of things like that. Okay. Example, look up D6 8.32, hemorrhage disorder due to extreme circulation anticoagulants. You know, I saw something like this with the anticoagulants is like a blood thinner. Be careful with this because in a lot of instances, I've seen a lot of people emergency room with this, and the coders are getting this wrong. Just take heed to this. Look that up. Hemorrhage. What is a hemorrhage? Just bleeding. There's a lot of bleeding. So just look that up and just be precarious of this one. Okay. Make sure you look for the drug. Now, sometimes the drug, sometimes you won't see the drug in the ICD-10 book. Go ahead and look in the Hicks-Picks book for the drug. You guys are supposed to get the Hicks-Picks book already. You're supposed to get that book. So make sure that you get it. This is it right here. You guys know what that is. You have to get that with your course. So that's required anyway. We got to go through that book because you're going to get something on your chest with that. Even though, you know, I know some of you are so glad that the chest is not following questions anymore, but 400 is still a lot. Okay, medical terms, use additional code for the adverse effect. This still has to do with drug overdose. Poisoning, use if necessary to identify the drug. Okay, look at the codes. Okay, I gave you that so you guys can go ahead and look up those codes. Look up any words you do not know the meaning of. Go search engine or get your dictionary. I still do search engine, but I like to have my dictionary too. Okay, so again, you know, look up those codes. Remember how I told you, if you're looking up a code that is leg, go to leg, go to L in the ICD-10 book. Okay, combination code. This is when a single code is used to clarify two diagnoses. A diagnosis with associated secondary process manifestation, or a diagnosis with an associated complication. That's like when I was talking about the cough in the lungs. Yeah. Okay. Right. It's still an associated complication. This supposed to be, this is an AAPC example. So we got this from AAPC. If a patient has nausea and vomiting, it is reported with one code because it sounds like it's a junction. It comes from the same area. So they would expect you to vomit with a lot of coughing like that. You see where I'm getting at? Mhm. Okay, good. If a patient has nausea and vomiting, it is reported with one code that describes both symptoms. It will be in that code. It will be in there. You have a description and it's going to say that in there. Look for the term vomiting and the index of diseases and injuries in your ICD-10 book. Got your book, you can look it up. And you're just looking this up for, you guys are just getting used to the ICD-10, but look up the vomiting with nausea. Oh, this is a good example. Look, you see how the codes are changing? And look how this is going up. This will be cheaper. And this is more. I'm just giving an example. The diagnosis don't determine the money. The procedure codes determine the money. But it's a good example of how invasive it is. Okay, and how more specificity they're giving you. Now you're getting to understand that, right? See. Okay, in this example, R1 1.2 is reported for a patient who has symptoms of nausea and vomiting. It would be appropriate to report two codes when one code describes the patient's signs and symptoms. Okay, put that over there. See, it's not as bad as you thought it was, right? You thought it was really bad. It's not bad. It's not bad. The good thing about it is that if you don't do the work, you're not gonna learn. Teachers don't do the work for you. Teachers put you in the right place to do the work. They show you the right place to do the work. Um, Being a medical biller, those of you who are going that route, um, requires you to know office standards, requires you to know front desk standards, it requires you to know the billing cycle. The coders require you to know coding, require you to be abreast on diagnosis, federal regulations, and what you can code and what you can't code. So just be precarious in that area. Okay. I know I'm confused all around, man. Got this one going on. I don't know what to talk about. Okay, so eponym. There are many different questions on the CPC exam. Here are two questions that you should review, although these answers may be in your ICD-10 CM book. You can still review these two here. Eponym. What is an eponym? These are going to be in your test. I have no doubt that you won't see some of these eponyms on your exam. This term indicates the code describes a disease. The codes describing a disease or syndrome. Okay, named after a person. I think I have, I'm going to change this to what I want it to be. I think I have a list of eponyms in your course. There's a list in there. I know I created a list for you. Take heed to them and put them on index cards. Make sure you put them on index cards so that you can get used to them. An example would be Lou Gehrig disease. Lou Gehrig was a famous baseball player who was diagnosed with what is also known as amyotrophic lateral sclerosis, ALS. We know it is ALS, right? Good, good. So that's an example of what an eponym is, okay? You see them throughout your course. I have a whole list of probably 20 for you. I'm not sure, but I know I have a few in there. Okay, take note. Very important for your exam to ask questions like this. Put this in your CPT book. There are many more eponyms in the medical billing and coding Q&A book. The Q&A book, that's your medical billing book. And that's a book that's also for people who are not familiar with medical billing. Maybe you have people who want to go into medical billing and coding and they're not familiar with it. They can get that book. That book is on Amazon. Yeah, I did. I wrote the book. I wrote that book. And don't forget, there's also an 18 series up there too. I have an 18 series of medical billing and coding. When I say 18 series, there are 18 different books, but there are different series in different areas of coding. So you can also purchase that on Amazon as well. Just type in Sapphire physician coding, or you can just tap in my name and you'll find that book or the title of this book. Okay, so again, make sure you take notes. Take notes, use your index cards. I'm index crazy. When you guys start your program, make sure you have your index cards. I don't have none in front of me, but I always make sure that I tell you guys to have your little index box and your cards. Label that box, what's in there, okay? Cardiology, cardiovascular, that's this index box. Integumentary system, that's in this index box, okay? So that you will know how to study. That's how you study, that's how you retain, okay? You're also going to have your regular books, but I want you to keep that as well. So modifiers and non-essential modifiers. Essential modifiers are subterms listed in the alphabetic index. Below the main term, there is alphabetical order and are indented. Two spaces. Non-essential modifiers are subterms that follow the main term and are enclosed in parentheses. They can clarify the diagnosis, but are not required. Now, the modifiers, the non-essential modifiers, when you go into your ICD-10 guidelines, you're going to see the non-essential modifiers. When you look at the bottom of your book, you'll see notes down there and they're color-coded and they'll tell you whether it is a non-essential modifier or it needs to be a regular modifier. Okay, so again, we're going to go over that. Sapphire exam tips and notes. Put all your notes in ICD-10 books. Do not put notes in other books, even if it's notes you need assistance with. Listen, I don't even need to read it. I told you guys before, you don't put the stickies in there. Don't put those little papers in there. Here they go, right? Don't put these in there. Okay, don't put this in there. You can put the labels in there. I showed you guys what the labels are. Okay, those labels you can put in there so you can change back and forth where you're at. Okay, if you put notes in all your books, you lose time. It's very costly, so please don't put notes in all your books. Okay, just highlight what you need to highlight. Okay, this is prevent you from going from book to book and trying to find all your stuff. I've done that several times where I've just overloaded stuff in my book. I can't even find anything. Okay, so just keep that at a minimum. Do not use a gel pen. Use a flat ink pen or pencil. Okay, I've done that too. The gel, I use that now. I use gel pens now. They get all over the place. They're over here somewhere. I'm looking for them. Okay. This is for your open and close questions. You can also put notes that will assist in this case. You know you got to use pencil, but I mean, even if you're doing your regular work, you cannot put any stickies in your book. We just talked about that. Okay, just write down what you need. Okay, conditions that are integral part of a disease or process. Integral as in it is in the same type of family. Codes for symptoms, signs, and ill-defined conditions are not to be used as for listed diagnosis when a related definitive diagnosis is established. That means that the provider has or the surgeon has indicated a diagnosis that he or she wants to use. Okay, you, the coder, make sure that it is justifiable with the notes. For example, an APC example, a patient is present with severe abdominal pain, nausea, and vomiting. The provider diagnoses the patient with appendicitis. In this case, only a code from appendicitis is sequenced. The nausea and vomiting are symptoms of appendicitis. Do not code them. Y'all got that? Because we know that it is, that's just like hypertension. Hypertension involves headaches. We know that one thing is related to another. You don't need to code it. It's already in there. I'm going to use another illustration. It's in the books. It's in the book. So you know if you code one thing and you know that you're getting this because of that, you don't need to do a separate code. If you do, that's what we call upcoding. It's upcoding. Okay. Okay, so to locate the code, refer to the main term. What's the main term? Appendicitis in the alphabetic index. The code is referred to in the index as, I'm gonna take this out because this is not relevant to me right here. Go to K37. Yeah, I know it has to be confirmed where, right, in tabular list. Okay, notes in an outpatient setting, you cannot rule out as in rule out a diagnosis. Suspected, working, differential, uncertain, or probability. The diagnosis must be certain. Okay. You're going to see that when you start getting in your ICD-10 and in your step-by-step, you'll see the definitions of the rule out, the suspected. You say you don't rule this code out because he might have that. Okay, and you can't code that. Don't rule it out. Don't do this because it's only suspected. Okay, we're just ruling that out. Just don't code it. We're just ruling it out. In an outpatient setting, you can report suspicious or rule out diagnosis for conditions that exist, such as HIV. HIV is the only condition that must be confirmed to report in the patient setting. Okay. Let's see. Code not. If the physician does not diagnose the patient with a particular disease, you cannot code it. We just talked about that. Even if the patient is suspected of having low iron or anemia, if the provider did not diagnose this, you cannot code it. That's kind of similar here. Like you can't code a rule out XYZ unless the provider says that's what we're going to do. That's what we think it is. We're not sure. We might can rule it out, but we're going to put that in there. The bill has to roll out. You have to have a diagnosis for the bill to roll out, and it has to be related to the patient's condition. When to use multiple coding for a single condition. Now, this is different. Before we were talking about one code, XYZ. Now let's talk about a little bit more. When it is a manifestation code, the etiology, cause, primary, and the manifestation, secondary, you will see notes that will indicate when to use the second code for a disease, such as code first underlying condition or code also and use additional code. Look out for these codes and notes when you're coding. So the first code as in the manifestation, the etiology, the cause of the disease would be the first code. It might say additional code needed. There's a color code in the back of the index that shows you when to add another code. It'll tell you, when you look in the index in the back of the book, you'll see indented, dented, you remember we talked about non-essential and all that kind of stuff. Everything will be indented when you need more. And it'll tell you when you need another code. You can't code this and you need another code with this. Okay? If there was no manifestation, use only code, use code only. Where you going? The barracks will also indicate to use this. That's what I was talking about. You see something to tell you to use additional code. That's what the barracks will tell you, that you need an additional code. Okay, and it'll be just like this anyway. So let's say you look for B76. If you look for B76, you'll see this in the brackets. I can't even say it, the brackets. Brackets. Okay. You must use the code in the brackets as well. Acute and chronic. We go over acute and chronic several times, but the more you go over it, the better you'll get it. When an acute and chronic condition is documented and there is a separate code for each, code both. Code both codes. The acute code is sequenced first. Okay? Acute is first. The difference between acute and chronic, look it up. Look it up. You want to tell me what you think it is? Yeah, acute is, yeah. Well, it's acute as in sometimes it happens at a short period of time, many times. Chronic is it happens all the times. Okay, good, good. And then again, you guys will see that. You guys will see that in your files. Quick information, you can study to go more in depth, read your CPC guide, use the exact definition AAPC uses in their guide for acute and chronic. Because there's this is what I need to tell you, there's two different types of definitions. There are different types of entities that use different definitions. AMA has a different definition that they use for that. And there are some codes that may be a little bit different in different books as far as the definition. This definition I want you to use is the exact one that they use for AAPC because that's what's going to be on their test. Okay. An acute condition is one that is severe. See, sudden onset and off onset. You keep getting it on and off. Chronic conditions are threatened and ongoing basis and may be coded as many times as required. You get it all the time. It's chronic. You get it all the time. And care of the patient or when applicable, like an asthma patient, care plan is administered. Do not code conditions that were previously treated and no longer exist. The history of the previous condition should be coded using Z codes only if the effect of the patient care or support the need for a patient to seek medical attention. Okay, so you guys can read this again. I'm kind of reading fast, but you guys can go ahead and read it again. But basically, do not code something that the patient no longer has. Okay, when it comes to coding a patient's well-being, that's a Z code. Well-being, as you know, like well cares, or the patients, you're giving the patient a checkup. Let me just look at this right quick. Okay, so we're going to leave that like that is. Sequela. Let's talk about sequela real quick. Sequela is the residual effect that remains after the acute phase of an illness or injury. Okay, and the illness or injury has terminated. So in the sequela, it's something that happens after you have an accident. Let me just run through it real quick because I need to fix something on that other slide. It looks a little funky. Let me just see what's on here. Okay, so we can go through this. The residual is the illness. In this case, code the residual first, then the sequela, because the residual is the cause of the sequela. Only in the circumstance it is not manifestation. It's not a manifestation disease. It is issue. It is the issue of the patient that the patient is having after an illness. Now, what I'm talking about is if you have a car accident, okay, and you have a hip injury. A year later, your toe started hurting. That's the sequela. That's the additional injury. That's what happened after the old injury. That's what we're talking about in sequela. Okay, remember sequelas use the injuries and after effects of trauma. That's what we just talked about. Okay, so put this on your index card, the residuals, the illness. Watch the spelling of sequela. They might ask you, how do you spell something? Okay. Let me just look at this. I saw something funky in this, but you guys understand what I'm saying when I'm talking on fast, because it looks like your auditor didn't catch a lot of stuff that I'm catching in here. That doesn't even sound like it's normality to me. But you guys know what I'm talking about. We're on the same page. I'm not gonna fix every little thing that I find in here that looks funky to me, but it's truth. Okay. So let's move on. When you are coding for sequela, watch the spelling. This word may be on your thing. I just said that acute phase of an illness or injury that leads to the sequela is never used with the code for the cause of the sequela. You guys know that I just said that because you might have an accident 3 years ago and all of a sudden his arm starts hurting. It could be related, but he doesn't have any pain in that no more, so we can't call that. Okay, the sequela will be first, and then the injury of how the sequela came about will be second. Okay, condition. If you're looking for an impending or threatened cold, look for the main term of impending or threatening. Impending as in this is what happened to the patient. Okay, or threatened. If you do not see your condition, go to the main term condition, then impending or threatening for illness. If it is not there, reporting the sign or symptom. What I mean by that is you could look for a related code. You can look for a related code, and that related code is your impending code. Your impending code, if you get there, you'll find the code that you're looking for. Okay, and that's in your guidelines. So make sure you look in your guidelines and read that. Okay. Doctor's notes will have that in there too. They might say impending. Okay, laterality. Watch the spelling on laterality. And I know I put that in there about watch the spelling. ICD-10-CM permits laterality, right or left. Reporting, left or right or bilateral. The ICD-10 codes is in there already. ICD-9, we had to code different codes, or you had to drop modifiers on there. Sometimes it's already in the code. If there was a bilateral site, the final character of the code will indicate what is lateral. If the site is unspecified, choose those codes. If there are no bilateral code provided and the condition is bilateral, assign separate codes for both left and right sides. Okay. Okay, and this is in your ICD-10 book. If you don't see it, then you know you have the codes for both. There are many codes that are in there that the left and the right are already in there. Okay, so that's pretty much just what it's saying. It might be in there already. Notes. In your coding ICD-10-CM guidelines, take as many notes as possible that you may need on your exam. You can write in your book. You can write in your book. Just don't write long paragraphs. You guys remember what I said? The proctor's going to look through your book. She's going to look through your book. Just make sure you don't have mountains of writing in there, because you're going to get lost in looking for something in there. Just write a couple of things in there that you know you can go back to real quick. And okay, I know it. But most of the fun stuff, the open and close questions are going to be in your guidelines. But again, you guys are going to get a lot of practice tests, and I still recommend that you guys also get those practice tests and put them in your files. Okay, they have practice tests on ICD-10 AAPC too. Okay, that's in addition to the ones that you get from me. Okay, you can always get more from aapc.com. They sell practice tests. I think they're about $20, $20. Yeah. Okay, so they went up. They used to be like 10 and 15. You guys can get that too. Okay. Take notes that you are going to use on your exam. There are many pages in the book. You have to put the notes on. Use your tabs. You can flip through these pages. But you need the tabs so you can flip through the pages. And the tabs are so you can find your stuff quickly. You remember those little pink tabs I had on the ICD-10 book? You're going to use those throughout. Put them on your CPC book too. You can tab whatever you want. And you can use those. That's the only types you can use. What you have read above is just a sample of what you'll be studying. On your Q&A in the CPC guide, you'll be able to retain the information and utilize the blank page with your notes. Those blank pages that are in there, that's where you're going to put your notes at. I don't think there's blank pages in the CPT. There's blank pages in the ICD-10. You could even designate a page for your CPT. Put some clues and some notes in there if you want to, but in your CPT, you're going to find spaces where you're going to put notes in there as well to help you on your tests. Okay. But just don't get lost. Don't get lost in the notes. Don't get lost in the notes. You don't spend 3 minutes and you still looking for notes, finding the answers. Okay. ICD-10-CM, is not only a tool, but is laterality also teaches you how to code. Okay, I said in this laterality. The books explain how to look up the code, how to check it, the medical terminology, and the coding skills you must have to locate a term. Okay, you need to have the medical terminology, especially because if you're not medical terminology savvy, these some of this stuff is going to get you. You see how I'm blib blabbing and biting my tongue when I see some of the stuff I see in here. So just be precarious with that. Go through your medical terminology. And this is just a tip. I'm pretty much I got tips through all of your courses. Read 2 chapters a day. Don't get lost in studying. Just set time for it. And you guys can text me as much as you want to. I will answer you back. Okay. This is another example of using the fifth character. Use your index card and watch your spelling. Okay. Uh, the sixth character might identify further specification. We talked about that. Why you need a sixth character. You guys can read this. Perceptual disturbance, delirium, delusion, hallucination, and sleep disorders. Anything in the F range is. I want to use a nice word. It's psychological, like even smoking. I know a lot of us don't think smoking is psychological, but it is. The people who smoke, you don't tell them that, it's psychological. I mean, they give people antidepressants to stop smoking. Um, I mean, it's just like food. I mean, you have to eat food and different things, and you eat a lot of it. It's, sometimes it's psychological. Your body probably doesn't want all that food, but your mind is saying, yes, you do. Your body might not want to smoke, and it's smoking anyway. So again, just pay attention to the condition. Let the insurance know how serious the patient condition is. Anxiety, XYZ, all of that is psychological. Those ZF codes, okay? Um, and you guys can stop this and read this. I'm just trying to get through because I've already kept you guys for an hour and 18 minutes. I don't want to keep you for that long. Okay, example subcategory M84.3. The appropriate seventh character is to be added to each code from subcategory M843. A is for initial encounter for fracture. D is subsequent encounter for fracture with routine healing. I'm not going to read the whole thing. We're in sequela, you know what that is. These are going to be used in more than likely the first consultation or a consultation with a provider. Second, third, fourth, may ever it would be, you may have to use one of these 7 characters. You would use the A most often for initial encounter with fracture. Okay, it could be initial encounter for whatever. Okay, now I'm just giving you an idea. K, subsequent encounter for fracture with non-union. That's because we're in muscle skeleton. That's why I'm saying that. Okay, these are tips. AHA, American Hospital Association, put it on your cards. CLIA, Clinical Laboratory Investment Amendment. Look this up. They're going to say what this is. This is in your PDF. So when you go through it, it's probably in there. Look at your medical bill, and CLIA is in there as well. This is like a lab test. Like we used to have to send in paperwork so we can get a fee waiver for like urine tests, dipsticks, and stuff like that. They're like little small tests, and they'd be CLIA waived. So just look at that. I know I'm saying it like you know what I'm talking about, but when you look it up, you'll get a more understanding, especially those of you who are working in a doctor's office, okay? HICFA, Healthcare Financing Administration, space, it's not a facility, no space. So just be precarious of this. I got to show you this because this just used to drive me nuts. Healthcare Financing Administration. I'm talking about this. Space, it's not a facility. Okay, if it's a facility, it's no space. Okay, if it's a facility, no, we're not talking about facility. Healthcare Financing Administration, space. Okay, it's not a facility. Okay, facility. I don't know what that is on my screen. Just no space. Okay, let me fix this because I need to clarify this. This looks funky to me. I add this if it is a facility, there is a space. So let's take this off. So healthcare hospital, healthcare nursing home, healthcare XYZ. There's no space. We're going to spell it like this, HEL, like that. If you see that on your CPC, know that there's no space for the facility. CMS, you guys know what that is, Center for Medicaid and Medicare Services. Okay, so this is the format. You guys know this ICD-10-CM. So don't worry about the PowerPoint. You already have this on the PDF. Yeah, it's on the PDF. When I see you those PDF files, just keep them in that same order. Keep them in that same order. If some of you don't have the Google Drive yet, let me know. I'll send it to you another way, or you can go through Teams and look at it. Okay. So chapter 14, diseases of the genitourinary system, N00899, section renal tubular interstitial diseases. Category 3, characters N13.7. I want y'all to look this up. Subcategory, fourth characters N1374. You see the characters going down? Subclassification, 5 to 7 characters N13972, 9, N13721. Look that up. All right, look up all those codes. Look at all of them. I want you to put them on index cards, okay? Test study, bold type, use for all codes and titles and typing the list. I'm describing what you're going to see when you get in there, ICD-10. Just coming down to the wire. There's only 3 slides. Don't leave. Just give me 5 minutes. Give me 5 minutes. Okay. Italicized type. Italicized type is used for all exclusion notes and to identify those codes that are normally usually sequenced as the first listed diagnosis. Sequenced as in which one is first. Okay. When you guys read your book, you will see a lot of detailed information in it. That's why I got the course for like 20 weeks, 25 weeks. Some of you are on fast track, and I have people finish this course in 11 weeks. But that's those who might be home. I know a lot of you guys are working. So just be kind of precarious at the time that you spend. I wish you could spend 3 or 4 hours a day, but I know that it's not possible for some of you. So some of you, you know, your goal is to complete the course in 15 weeks. But just be precarious. I want you to take your time with the course, the tasks, the competencies, so that you can pass your tests. Okay. So again, you know, your primary goal is to pass your exam. I want everybody certified. Okay. I don't want you guys having any type of problems when you go to get a job. Some of you want to work at home or independent. And I'll tell you that this again, AI is coming. We don't know when, we don't know how fast, but I've seen AI all over the place and it's taking jobs like crazy. I have a video of my friend and he came from North Carolina and I took him to the supermarket and he saw the robot in there and the robot took the place of a couple of employees because it's doing certain things. And he's standing there, which is ridiculous. He's standing there talking to the robot and saying, you know, this is what's going to take our jobs and stuff like that. I mean, I gotta ask him, can I post that video? But I don't think he's gonna let me do it. But I'm telling you, AI is coming. Okay, so books. These are your books. ICD-10-CM, Step by Step, CPT, Language of Medicine, Medical Insurance Billing. Okay. Get your books. Some of you who don't have your books, that's fine. You have time. Thank you. You guys know who I am. That's my email. The website. You guys know the website. I put the website all the time because you never know who you know who you may know, you know, as far as someone that may want to do the class. So, you know, tell your friends, let them know. And, you know, I always, you know, work things out with people. So, you know, again, just try to get your books. Try to keep this down to an hour. But we kind of went over and, you know, I did stall a couple of times. I see some stuff in here that I probably need to look out for. But again, you guys call me if you got any questions. Look at this video with your ICD-10 book. But those of you who have not started the full program already, you know, just look at this video and get a good feel of what is going on in the video. Okay. So again, you know, sometimes you need more intuition, you need more work, you need more coding, you need a lot of things to help you with what you need to. In this case, just follow the program. I don't know why this thing is stalling, but it's finished and we can kind of keep it moving. and I'm gonna see you guys next time. So I'm gonna stop the recording, and you guys have a great day.